Good afternoon, everyone. Welcome to this ENO Center for Transportation webinar. My name is Brianne Evie. I'm a senior policy analyst at ENO. And for those who are unfamiliar, ENO is an independent, nonpartisan, and nonprofit think tank that shapes public debate on critical multimodal transportation issues and builds an innovative network of transportation professionals. Today, we're discussing mobility responses to COVID-19, specifically cities' build-outs of new active mobility infrastructure with Dr. Tabitha Combs. Dr. Combs is a research associate and lecturer in the University of North Carolina's Department of City and Regional Planning. You can enter any questions that you might have throughout the presentation in the box on the side of your screen at any point, and we'll get to as many questions as we can during our Q&A. We don't expect any tech issues today, but we've found that if you do experience any sound or video issues, exiting and rejoining the webinar tends to help with any minor issues that might come up for individuals. ENO is happy to offer our webinar series free of charge. If you enjoy our webinars and are interested in supporting ENO's work, we'll have a link available to donate or to become a member. You can find slides and a recording of the webinar on our website, enotrans.org, after today's presentation. The recording will also be emailed to all registrants within 1 day. With that, take it away, Tab.
All right, thanks, Brianne, for that introduction. As Brianne said, I'm a planner. I work in the Department of City and Regional Planning at the University of North Carolina. I also do a lot of work with the Highway Safety Research Center and the Pedestrian and Bicycle Information Center. And those are some of my partners with the work that I'm going to be presenting today. Full disclosure, I am a planner. I'm a planning academic with professional and academic degrees in planning. So a lot of what I'm talking about today, well, what I'm saying is aimed specifically at the planning profession. But this information and the lessons that I hope we draw from it really applied broadly to the planning, policy, and engineering fields, as well as to advocates and others who are just interested in equitable, sustainable, and resilient mobility systems. So during the first 6 months of the COVID-19 pandemic, cities around the world took bold, creative steps to change the way that people use public space. Most notable of these changes were changes to the way roadway space was allocated. As schools and businesses shut down, and workers who could work remotely stayed home, we saw a really dramatic drop in motor vehicle traffic and a simultaneous spike in demand for safe places to walk, bike, and exercise outside, physically distanced from other humans. Thousands of cities around the world responded to this change by taking road space away from cars, giving it over to other public uses. I spent quite a bit of time over the past year gathering information on these changes, these local, state, national level responses to these changing mobility patterns that were due to the pandemic. I've gathered data from crowdsourcing, from surveys, and from what I like to call rigorous Googling. Today, I'm going to share some of what I've found through documenting these responses around the world, and how documenting, interrogating, and evaluating these responses may, or hopefully will, show us the way to better practices for urban mobility planning and policy. And by the end of my talk today, I hope I'll have convinced you that as interesting as it's been tracking the responses themselves, it's not just what happened that matters, but it's how and why it happened as well that's going to matter for new mobility practices moving forward. So the pandemic ushered in a dramatic shift in how cities think about and allocate space for people who walk, roll, and bike. Creating space for non-car modes normally takes years, if not decades, and sometimes it never even gets off the ground. But during the early months of the pandemic, cities seemed to be able to create these spaces practically overnight. So something big shifted in the way city leaders thought about and valued public roadway space. A lot of people are asking, understandably, which of these changes to public space are going to outlast the pandemic? When they ask me that, I usually respond with, how has the pandemic changed practices regarding the allocation of public space? And which of those practice changes will stick around after the pandemic? And hopefully, again, during the course of this webinar, you'll see why I believe that's the question we need to be looking for answers for. So the state of mobility practice. how we plan, design, install, and maintain our transportation infrastructure and mobility systems is in pretty dire need for an overhaul. The economic, environmental, and social costs and cost disparities of car dependence are all really well documented, but changing the status quo has been hard. Any gains we get in moving away from a car-based mobility system are marginal and desperately hard fought. But COVID was somehow different. The pandemic underscored these longstanding inequities in mobility systems, highlighted the lack of resilience in these systems, and in some cases, and for some people, gave a glimpse of what could be, meaning that it revealed previously underestimated demand for non-driving uses of public space. And it did so in a way that previous crises seemingly failed to do. Think climate change, road safety, obesity crises. None of these have been able to move the needle like COVID did. But the pandemic also revealed problems with planning processes. Can we really only have good walking and biking facilities when we ran them through overnight as part of a crisis response? Did we not learn anything from the previous 70 years of top-down transportation planning that was kicked off by the Interstate Highways Act? Can we not take the time to engage the public in decisions about public space and still be able to create these public spaces for non-driving modes? And is the pandemic really the best way to change transportation? As we're hopefully emerging from the pandemic, we need to learn both from how mobility needs changed during this time, but also from the processes behind our city's responses to those changes. That's the only way, I think, to move forward toward a more just and resilient transportation future. My goal is to support this effort by creating and advancing a knowledge base for learning from what I call the COVID streets phenomenon, so that we, all of us in the transportation fields, can hopefully identify and support development of new, better practices for mobility planning. So talking about practice change, there are a lot of theories about how practices change in public policy and how new best practices are identified, adopted, and spread across the field. What we saw during 2020 has encapsulated many of these theories. So the pandemic just triggered this simultaneous global recognition of a problematic outcome, that being that there's not enough public space or safe mobility options. So that was an outcome of conventional practices. So the simultaneous global recognition that conventional practices aren't working. Cities then made rapid adjustments to those practices on the fly. They looked to each other for novel ways to make these adjustments, meaning that the ideas and changes spread around the world almost as fast as the virus itself. And many cities also figured out how to evaluate the impacts of their changes. And in some cases, even reflected on the processes behind those changes and adjusted them in situ, meaning as they were situated on the street, and did so on the fly. And all this occurred simultaneously at global scale during the course of less than a year. Anyone who studies practice change knows that is just baffling. It's absolute chaos, really. But in that chaos, sorry, I think a limb just landed on my house. In that chaos, there's some pretty powerful lessons, pivotal ways in which practices were altered, and in which norms and goals about public road space shifted, and in which mobility outcomes changed. Some of the shifts in how cities treat public road space had negative unintended consequences, but many others seem to have arisen through pretty positive processes that in turn may produce long-lasting positive impacts that may be replicable even in non-pandemic times. By documenting, cataloging, categorizing, and evaluating these changes, I'm hoping we can start to sort through the chaos and identify the processes that cities used, link them to outcomes, both good and bad, so that we can start figuring out which new approaches, which new planning processes might become our new best practices in a post-pandemic, but not post-crisis world. So in short, I'm trying to build a brand new knowledge base for new best practices. I'm not building the best practices. That's far beyond this step. I'm just trying to establish the knowledge base that we can use to draw on for these new practices. There are three main components to building a knowledge base. We'll walk through all three of them today. Document what happened using standardized, consistent language and framing. Understand the current state of knowledge, so what we know what we think we know and what we still have to learn, and then expand that state of knowledge by conducting research to understand how and why the particular phenomenon happened, who was involved, and to what end. So we'll start with documenting what happened. There's still a lot more information out there that needs to be collected, but I think I've given us a pretty good start with my own efforts. Back in March last year, I saw a Google alert about the city of Philadelphia's decision to start their summer open streets program early in order to create COVID-safe recreational space. And I thought, hey, are other cities going to do this too? So I went on social media to find some examples, and I pretty quickly got overwhelmed. So anyway, fast forward 13 months, with support from the Ped Bike Information Center and from Carlos Pardo of the New Urban Mobility Alliance, we've now got a data set that to date has almost 1,400 such actions in more than 500 cities and regions around the world. 844 of those actions involve explicit reallocations of public road space away from personal motor vehicles and towards walking, biking, and outdoor commerce. The database is called the Shifting Streets Global COVID Mobility Database, and it's available to download and use for free at pedbikeinfo.org/shiftingstreets. So what does nearly 1,400 crowdsourced records on street changes look like? Chaos. And one of the things that's been the hardest about it is that there's no real common language for talking about all these interventions. In most places, it seems there wasn't a playbook for adapting transportation networks for a pandemic. So city leaders had to get creative, and I had to get creative coming up with new definitions of interventions on the fly early on. So I was inventing new ways to describe the wide and growing range of things that were happening in, on, and around streets all over the world. Through several iterations of cleaning and organizing the data, I realized that one of the main barriers to understanding and talking about what happened is a lack of common language to describe these events. I saw journalists, advocates, practitioners, researchers all struggling to find just the right term to use to talk about specific kind of action or intervention. Many people started defaulting to what I call the big three: open streets, streeteries, and pop-up bike lanes, to talk about a wide range of different kinds of things. And I see these terms thrown out all over the place, applied to things that they're not even close to really being, and it's confusing. And I think that's hindering us being able to understand what happens. So one of our major projects with this database has been creating and disseminating a standard lexicon, a common and hopefully simple language for categorizing and describing all of these new innovations of ways that we can treat public space. With the help of PBIC, we're putting together a glossary, I guess a user's guide, if you will, to understanding rapid street space reallocations. And we hope to be able to distribute that in the next couple of weeks, pretty soon. I'll use the lexicon in this presentation, focusing specifically on two variables from the database, function and application. Function categorizes cities' responses according to their basic function. I think it's self-evident. And application breaks that down into a little bit more detail. On the screen is sort of a quick start guide to the database with these two variables. Go ahead, screenshot it if you like. Hopefully it can be a handy reference for you, at least until we get the glossary out. So this tree map is meant to give you sort of broad brushstrokes of the scale of COVID streets interventions around the world. The unit of analysis here is the city application or city function. So here we've recorded 157 cities that have converted some motor vehicle traffic lanes into street space for pedestrians and bicyclists. So that's an application happened at the city level. And then here, 16 cities have converted traffic lanes into street space for outdoor commerce. So you can see, looking at this, that quite a bit happened. And I want to stress that this is just what we've managed to record and validate, again, mostly through crowdsourcing and rigorous Googling. If pressed, I'd guess that this represents only maybe 10% of what actually happened so far on streets around the world, and also that our records are heavily skewed towards some parts of the world over others. This map, which was produced through DataSketch, one of our partner organizations, shows the relative frequency of entries into the database by country. And you can see disparities in representation pretty clearly, which is to say we need help capturing data and potentially new best practice models from the rest of the world. We've definitely got some pulls on what we've been able to capture. So I'm going to take a minute to beg, please help us get the word out that we need more information to populate this database. The broader net we cast, the more useful our knowledge base is for developing practices. If you want a way to visualize all these changes, here is another form of map, I guess, showing where the actions took place vis-a-vis street space. This diagram shows everything we've been able to record and validate up through September of 2020. You're welcome to dig through this image on your own if you like. You can download it from the open access paper through the link on your screen. But I'm showing it here in case it helps you grasp the enormity of how cities changed up their street space. And again, these numbers, these figures on this diagram aren't individual streets that have been altered, but cities that have not taken these particular actions on their streets. And the main takeaway from all of this, from showing you sort of these big numbers, is that the pandemic prompted a wave of new approaches to accommodating walking and biking all around the world. A big wave. And these approaches all had one thing in common. They happened fast. The traditional barriers to implementing walking and biking facilities, that there's not enough space, not enough money, not enough analysis, not enough support, they seemingly vanished overnight. And this vanishing act raises some really big questions. Why did the barriers disappear? And will they stay gone? And I'm guessing another question that's on a lot of our minds is, will the changes we saw happening during the pandemic stick around? Answering this question is a big part of developing new practices because thankfully, hopefully, we're not always going to be living with the crisis conditions that trigger all of these changes. And we can start answering these questions about what changes and what new practices might outlast the pandemic by examining the motivation behind cities' various responses. And we can get to that by looking at the evolution of responses over time. So early on, back in March 2020, cities were really focused on minimizing virus transmission by creating things like takeout zones for restaurants and automating walk signals. Then in April, we see a huge interest in creating street space for walking and biking. That's a solid blue line. In the beginning, this came almost entirely in the form of full street closures in cities that already had a history of these kinds of events. But as that line gets steeper, we start seeing a lot of curb space reallocations as cities look to really create new mobility corridors to make up for drastic drops in transit ridership. We also see a lot of soft closures or partial closures of neighborhood streets, partly to help connect those mobility corridors, but also in response to recognition that kids are going to need to be out of school for a very long time and they need safe places to play. We can't shut down every road, but we can at least make certain neighborhood streets a lot safer by limiting or slowing motor vehicle traffic on them. And then once summer rolls around, we see a growing interest in carving out street space for commerce. That's the solid purple line. As cities started to respond to calls from restaurants and stores that were desperate for safe ways to stay open during the pandemic. So what we're seeing here is an evolution from public health responses to reduce the risk of disease transmission, to reacting to changing mobility demands, to keeping businesses afloat. And to me, this is all signaling a gradual recognition on the part of cities that public space isn't best used for driving cars. Another key is to look at when individual cities began their responses. So here we're seeing the start dates for US cities changes, specifically the allocation of street space for walking, biking, and outdoor commerce. As you can see, some cities were able to move quickly and comprehensively, while others had substantially slower and much more limited responses. Part of what understanding what happens next depends on understanding these differences in response speed and scale. Was it differences in active mobility cultures, differences in state level policies and resources or institutional frameworks, or maybe it was something else. I don't have the answers to these questions yet, but hopefully as we keep collecting more detailed information, some answers will start to emerge. And finally, we need to talk about where and from whom the ideas for these responses came. I mean, if we want to know what new best practices ought to be, we need to know how cities determine whether, how, when, where to act. and who got to be involved in that decision process. Because at the same time, many people were rejoicing, cities were finally willing to make dramatic changes to how people get around, others were pointing out that this process, these dramatic overnight changes to street space, many of which required police involvement to implement and maintain, was just another manifestation of entrenched systemic racism in planning. And the data may bear this out. The vast majority of these actions we saw popping up were unlinked from public input processes. Up to 92% of them were entirely new, explicitly in response to the pandemic. They weren't part of a pre-existing plans, and in most cases weren't even connected to any sort of ongoing community discussions about mobility. I mean, yeah, there are some exceptions, but wow, that's a lot of top-down planning that affects huge amounts of public space, and that's problematic because it signals to me that the top-down approach to transportation planning that's plagued our cities and alienated our citizens for over half a century is still what we fall back on when the going gets tough. Top-down planning for active transportation modes is still top-down planning. So that was documenting what happened. Next up in building our new mobility practice knowledge base is marking out the current state of knowledge, identifying what we know, what we think we know, and what we need to learn more about. Here's what we know. Cities did a lot of creative things, which means cities learned they can do a lot of things. The rapid and wide-ranging responses suggest cities really do have the ability to be creative. Barriers that had previously blocked or slowed new ped bike and road safety infrastructure were overcome. Cities became more tolerant of experimentation in their transportation systems, and new public engagement, innovative public engagement strategies started to emerge. So that's just a quick rundown, an aside, I think, of some of the biggest new tricks cities learned last year. They learned how to act quickly. They learned how to use temporary materials and limited budgets to implement new ideas. They learned how to adjust projects in situ after initial implementation based on observations of effectiveness and utility, as well as on public feedback. In some cases, they learned how to engage community members in new ways. Well, it's true, the majority of projects that went in did so absent initial public input. Some cities did find ways to interact with stakeholders during it and after implementation. And there's evidence those interactions did far more to support public participation than the traditional pre-implementation public meeting model. And finally, and this is a big one in my opinion, cities were forced to acknowledge that the traditional warrants-based approach to active mobility really undersells the need for infrastructure. In other words, they saw that there is substantial unobserved demand for safe walking, biking, and recreation facilities. The ped bike advocates have been hollering for years, if you build it, it will come. Finally, this is sort of their I told you so moment, where cities did build it, absent the studies about demand, and suddenly these facilities were widely popular in a lot of places. So here's what we think we know. Cities' responses seem to track somewhat with the pandemic, which suggests these were crisis responses rather than strategic or plan-based responses. And the data from the timeline of intervention rollout and stated drivers of these rollouts, both of which you can get from the database, support this idea. We also believe that the vast majority of the responses aren't linked to previous or ongoing planning efforts in most cases, and public engagement wasn't often a priority. Now, there's exceptions. There's some bright spots, exceptions to this, including places like Oakland, California, which pushed through their slow streets interventions rapidly, got in a lot of hot water with the public, and then started over, letting community members really be the ones to set the agenda of what sorts of interventions would take place and why and for what purposes. And there are probably a lot of other examples out there of cities that, even if they started with a top-down approach, quickly figured out how to do it more from the bottom up. And the more we can learn about those examples and the processes behind their decisions on whether and how to act and who to involve, even if they do it after the fact, the better equipped we are to develop new best practices. And finally, here's what we need to learn a whole lot more about. First, with respect to processes. Where were these bright spots, these places like Oakland, and what made them work? What made them shine? What new ways of interacting with the public emerged that worked? Which of them might prove useful, relevant, and actionable after the pandemic subsides? Does having a mobility plan matter? Recall that most of the responses we reported weren't connected to existing plans. Why not? And how can we change that for future disruptive events? For cities that do have mobility plans in place, what can we do to ensure the information contained in those plans is available to guide how we react during times of crisis? And what other policies or programs might be put in place now to allow for more flexible and equitable responses to future disruptions? I think one good example is from Washington State, where the state DOT published guidelines early in the pandemic on how municipalities can go about reallocating space on state-owned highways. And I'd love to know whether stuff like this might be a harbinger of a movement to say, incorporate mobility in state-level emergency management plans. Use state policy to bring transportation and emergency management more closely together, and recognize that how people get around in a city depends on and affects emergency conditions that are taking place in that city. We also have a lot to learn about the long-term impacts of these interventions. We have a little bit of data already. Places like EcoCounter and individual cities themselves are doing a bang-up job recording travel changes, but we need to go beyond the immediate impact on travel behavior and look at longer-term impacts across a wider range of metrics. Because the feedback on these various responses is not unequivocally positive. Some interventions in some cities work better for some people than others, but there were vast systemic disparities in the distribution of costs and benefits of these interventions, and that's something that's readily evident in public feedback and in a lot of media pieces that we're seeing. And as a field, we need to get a handle on these impacts, because despite the tragedy of the pandemic and the arguable missteps in our responses to it, there are some tangible benefits that have emerged from the COVID streets phenomenon. The biggest upshot, in my view, is how cities have managed to dismantle many of the formerly intractable barriers to ped-bike projects, and lack of money, precedents, or in many cases, what I call battle-tested safety standards. That sort of put us in an analysis paralysis sort of situation. And so the big challenge, I think the big question is how to advance such projects through an inclusive process, creating structures and facilities that work and that work across populations, and ensuring that costs and benefits are equitably distributed. To me, this is the big overarching research question that we need to be tackling. And that brings us back to my argument that we need a whole new approach to mobility planning based on this research question, and based on the lessons we can take away right now and in the coming years about how the pandemic affected how we live, work, travel, and participate in our cities. And this is how I think we get there. By expanding what we know through rigorous practice-linked research that recognizes the forces driving cities' mobility responses to the pandemic, that explores differences in the response speed and scale of cities' actions and local response timelines, that digs deep into the role of planning and public engagement in motivating and shaping cities' responses, and interrogates the processes behind those responses, and evaluates impacts broadly through seeking out information from a wide range of perspectives on a wide range of kinds of impacts. So these are the next steps, as I see them, to develop this knowledge base that'll help lead us to new, more just, and more resilient mobility systems. So keep documenting what happened, why, and to what effect. We're working with some research partners now to create a structured case study guide that'll help enrich the database and deepen our understanding of cities' responses. These case studies, we hope, will help us compare differences in how cities rolled out their interventions And so what enabled some cities to respond quickly and adapt on the fly, while others seemingly took eons to make their first move? We need to interrogate the role of planning and public engagement in informing these responses. A lot of cities have robust mobility plans, but they weren't used to guide cities' actions. Wondering why not, and whether those plans would be useful in this sort of situation. Also worth knowing, if the apparent newfound tolerance for experimentation using temporary materials, does that allow for more meaningful public engagement practices? Because the stakes are lower, you can try new things, you can tweak things on the fly, and in response to public feedback. Does the ability to see your city change what they're doing in response to feedback, does that encourage public engagement, and does it lead to better ultimate outcomes? And if so, should we keep experimenting with temporary materials in the future after the urgency of the pandemic has subsided? My co-author and research partner, Carlos Pardo, and I have laid out these questions into a research agenda. I'm not going to go into the weeds on it right now. I think that could be painful, but if you're interested, you can see it in the paper that we published this past winter. In the link on the screen right there, that's an open access paper, and I encourage you to take a look at it if you're interested in understanding how we can learn from this COVID experience. But I'm also really curious to hear what you all think on the webinar. What questions do you want to see tackled as we look to build new best, or maybe just better practices for creating safe, equitable space for walking and biking? Thanks. I'm happy to take questions and bad ideas around with you now or afterward via email or social media. And please share what you know, share what you're learning, what you're seeing about the implications of COVID mobility responses on the practice of mobility and transportation planning, because we're all still learning. We don't know yet what lessons we've learned from COVID, because we've only just now started learning them. We're only scratching the surface of what we need to learn, only just now starting to understand what happened and what the impacts of what happened are going to be in the long term. Thank you.
Great. Well, thank you so much, Tab, and thanks to our audience. We've had a bunch of questions come in already, but just a reminder to folks that we have until the top of the hour. So if you have any questions or input right now, now's the time to do it, or you can get in touch with Tab, I'm sure, after the fact as well. I'll start off here with a question, Tab. Could you describe what the role is for various institutions or actors to respond to this information? So for example, how should governments at all levels, so federal, state, and local governments, how should planners, how should community groups and other groups and individuals take this information and put it into practice?
So that's a great question, and it kind of gets to one of the reasons that we started investing time in this database. Early on, the goal was to just put examples out there that other cities could look to sort of bridge the peer learning gaps. Now I think we're just starting to see some trends emerging from the data. And again, the data is not, it's not a globally representative sample. It's just what we've been able to find, and so. I don't encourage anyone to use it for rigorous academic research, but from an institutional standpoint, I think if you're looking to see the experience of another city, if you want to know what a peer city is doing, or if you want to look for examples from places that maybe have a different approach to planning, that information is all there. We've got pretty detailed information about what sorts of action cities took, and in some cases who to contact to get more information. I think as we expand sort of the depth of the database with these case studies that I mentioned, cities can start to learn more nuanced lessons from what other cities have done. Maybe about what the approach to equity or social justice was, what the feedback was, how these different sorts of interventions, whether they were converted to permanent, whether they were canceled, whether they were just allowed to expire sort of on schedule. And so I think, from a government standpoint, from an institution standpoint, there's just sort of a lot of learning from the successes and mistakes of others. From the practice standpoint, I think that's where we need to start looking across examples for things that start to emerge, for things that consistently seem to yield positive results, and things that consistently seem to yield pushback or have unjust or inequitable results. But we still need to gather a lot more data before we can start building those things. A lot more nuance about the individual cities' processes.
Sure. Tab, does your database account for or catalog the policies and regulations in place in different cities that may affect the ability to build out this type of infrastructure, or is it more just sort of cataloging what's been done? And then sort of a related question that someone asked is, did cities realize that the barriers that they might, policy barriers that might have been in place were always self-imposed, or did emergency orders allow cities to kind of bypass some of those legal barriers?
So I'm gonna tackle that second part first. I'm not a city, so I don't really know what was going on in their heads. But I mean, I guess cities don't have heads, but city leaders. But I suspect in a lot of cases, emergency regulations allow cities to move forward and make changes. In other places, I think the fact that a lot of the interventions don't seem linked to plans tells me that maybe these interventions weren't implemented through planning departments, but through public works. The city was like, we're in a crisis situation. We need 1,000 cones. Who's got 1,000 cones? Public Works has 1,000 cones. All right, go out and put these cones out and create a pop-up bike lane. I think we didn't go through normal planning processes, so all of the places where things get held up in the planning process, which isn't these holdups aren't always bad, but they are things that slow down rapid responses. Those things weren't in the way, and so I think that was probably a part of what was going on. In other cases, some of those barriers were exogenous to the community. We heard from communities that were saying, we want to take action, we want to do this, we know that our people are demanding, but we're hamstrung by state policies and regulations that won't let us do particular things. And so while I understand the sentiment that a lot of these barriers are self-imposed, they're not all self-imposed. And so a lot of cities had to get creative to find ways to work with the state or to work with neighboring communities, or work with their own engineers to try things that were untested. And it wasn't always easy. I know that a lot of cities really fought hard just to get the ability, just to be granted the permission to do something different. And then the first part of that question was, does the database account for policies and regulations that may have already been in place that affected the ability to build out? It does not yet. That's something that doesn't really come through readily in crowdsourcing, because a lot of the times we're hearing from people who are either not involved in the planning process, or they were involved but they just they're not speaking from a policy standpoint. Maybe there was someone from Public Works who was putting out the cones. And so one of the things that we're trying to do with the case study process that I mentioned, where we're giving people a guide and saying, if you want to contribute, take this guide, go interview some people in your community, and the guide will help you figure out who to interview. Go find certain sorts of documents that will help us understand what the context was, what the culture was, what policies and regulations may have already been on the books. Because you're right, some places it was a lot easier than others, and there's probably a policy context that made it easier in some places than others.
Sort of a follow-on to that just came in. So in light of the recently updated NUTCD, are there any thoughts on how the newly updated document might play a role in keeping or removing some COVID street policies in the future?
I haven't dug into it. I've seen, I was involved in some responses to the draft. But I think what's interesting to note is before the update, there was language in the MUTCD, there was guidance about how to do temporary interventions. And I'm not sure that many cities consulted that guidance. Maybe a lot of them did. And again, I don't have that kind of information, but it's not obvious that the MUTCD played a very big role in what a lot of cities did. And so, yeah, I don't know. I'm interested to see moving forward if it's gonna once that we get past this crisis situation, if it's gonna start to kick in and have more of an influence. And I may be completely wrong about the influence of the MUTCD during the initial wave of COVID responses. But that's my impression from the 30,000-foot view.
Were there any challenges with incorporating international examples into your database, or maybe on the flip side, any particularly interesting insights from how international places are collecting this information that is maybe different from the US experience?
Yeah, I think the biggest challenge was just representation. I speak English. I speak a little bit of Spanish, and I've learned a lot of key words and a lot of other languages during this process, but it's been hard to gather data that is representative outside the US. Carlos, my research partner, is based in Bogota, Colombia, so he's been able to help, and we've got good connections in Latin America. And so we're starting to cast a wider net. There's still a lot of places where we don't have good information or even any information. And I think a lot of that has to do with our networks, but also a lot of it may just have to do with, with transparency in government. Maybe things happen that never make it onto the internet. Maybe things happen that there are no channels, there's no way for me to figure out who's in charge of them, who I can send a survey form to. And so really it's getting the information out that we're collecting the data has been the biggest barrier. I've not yet run into challenges in figuring out how to catalog the actions that cities have taken. Again, when we started, I was getting information from all over North America, Latin America, and Europe. And on the fly, I was having to create new categories. We ended up with a variable that had 32 different kinds of actions that cities had taken, just to improve conditions for walking and bicycling, because we're seeing different contexts, different regions of the world try different things. But generally, it all kind of sort of converged on this set of functions that I talked about earlier. We saw huge networks of pop-up bike lanes, so curb space reallocations popping up in cities all over Europe. Less popular in the US. I think there's some fear of legal action that may be taking place there. In the US, we see more open streets or closed streets, whether that's fully closed or partially closed. So difference is sort of in the overall trends of what we're seeing, but once I've made the connection and I've identified that something happened, it's pretty easy to figure out what it is and put it into the database.
That's really interesting. So the next question is about asking how were mobility improvements that were planned and designed prior to the pandemic distinguished from COVID responses in your database? And then somebody else asked, what exactly does it mean that 92% of the actions that were taken were entirely new? Does that account for things that maybe happened prior to the pandemic? Right, or was it the first time that these cities employed some of these practices?
Yeah, and that's a great question. That information that's our best guess. That the 92% number, 90%, based on the information that we were able to find about a particular intervention. So when people sent us information, about different interventions, one of the questions that we specifically asked for was this linked to an existing plan? Was this, just fast tracking something that had been on the books already, or was this, maybe just in line with existing policies and efforts, even if it wasn't specifically called for in a plan? Or was it something that came up completely independent of those efforts? Which would mean it's a strictly COVID response. And that's where we're getting that 92-ish% number. From the best we can tell, is that most of them, 92%, the responses fell in that category. That it wasn't called for in a plan. It's not fast tracking something that was in a plan, and it wasn't part of a known planning process. We've validated that data as much as we can through our our own Google searches. We had a team of graduate students in Colombia who helped us try and validate that information. We may have made some mistakes. Or it could have been that the people who were giving us the information just didn't realize that something was part of a planning process. But from what we can tell, and the way that it's been talked about in the media, most of these actions were strictly responses to COVID.
A couple questions now on just kind of the extent of the questions that you asked. You may or may not be able to answer some of these, but for the first one, have you seen cities change or reduce their parking requirements for businesses in response to reduced vehicle traffic demand? Again, you might have not even asked that in your questions.
We did not ask that, and I don't know. I don't know if that's something that cities are going to look for moving forward. I know that effectively parking was reduced in a lot of places. Cities allowed businesses to expand their operations out into parking spaces, and so we know that if you put up a pop-up restaurant in a parking spot, that's one less parking spot. But I don't know the extent to which that has been codified. I'd be surprised if it hasn't. We have record of a number of places, and again, this is a vast undercount, that have developed new mobility plans in response to the pandemic. And I'd be surprised if we didn't see changes to parking requirements in those new mobility plans.
And then another one, does your database include when the shelter in place was first imposed and then when various waves of COVID were happening for different locations?
It does not. And I think that is something that would be really useful to put in there. And I think it wouldn't be too terribly hard to do. If anyone wants to volunteer to help us track down that information, I would be happy to get to know you. It's just one of the, it's a thing we haven't gotten yet.
Sure, yeah, I imagine that information is pretty easy to tack on after the fact.
Yeah, and I think it would be really informative. When I showed that timeline, we're looking at overall when waves of COVID and COVID responses in terms of lockdown and shelter in place were hitting different countries. But we haven't looked at the city level, and it would be really interesting, I think, to try and bring that in.
Mm-hmm. Have you done any kind of assessment of the build-outs that haven't stayed in place, that new applications that really haven't stuck around?
No, we haven't. We are trying to gather data on when these different interventions expire or get taken down. It's hard to get that information. People seem to be really excited about reporting information when something new appears, but a lot less excited about telling us when it goes away. And so we have what I think are pretty solid start dates on most of the records in the database. We don't have too many end dates. So it would be nice, and I think that's something that we can learn a lot from too, is what happened afterwards. I know anecdotally, just through my process of looking for information about actions to build out our case studies, that a lot of cities, they implemented a response, they collected data on it, they took it down at, when they had said they were going to. And then they came back with new waves. So, well, we're going to do this again, but based on the data that we've collected, we're going to tweak it a little bit. I'm curious to know whether they're sort of doing their second and third round of implementation because of what they found in the first round, or because they thought that COVID was over. And now they're realizing, no, wait, it's not. We're still in this. And so I think would be really interesting and really telling information to try and gather.
Then one final one that's sort of along this same theme of, whether this is in your data or not. So somebody mentions that public transit ridership is still way down post-COVID. Is there any insight into what mode of transportation folks have switched from if they're not taking transit anymore? Is there a sense of if some of that ridership is now being captured by active mobility infrastructure?
Yeah, I know I've got some colleagues that have been working on conducting surveys about that, about mode shifts, and whether the loss of confidence in transit or the loss of service levels of transit cause people to shift to active modes rather than to driving or to not traveling at all. I'm not sure what the results of those surveys are, those studies, but I know that those are underway in a lot of places.
Are you seeing examples for how cities are using some of these insights to rethink how they work in non-emergency situations? So in other words, are these practices, I think as you kind of talked about in your presentation, are they transferring over to a more systemic way of doing business within cities?
I hope so. And I think that is the key question. Is have we learned anything? And will what we learned, can we translate that? Can we move it post-pandemic? Because we're still in mobility crisis, right? We've still got people who can't get where they need to go safely. Obviously, we still have climate change. We have the environmental effects of people being car dependent that are going to stay with us forever. So we still have a lot of the same pressures to have this infrastructure. We just don't really feel the urgency. And I do wonder, I don't know the answer. I've seen little glimmers here and there, cities that are developing these new mobility plans, cities that, or even entire countries that have dedicated whole new pots of money, giant funding streams to implementing new walking and cycling infrastructure in response to what they saw early in the pandemic. I think New Zealand is a really good example. Very early on, they saw a lot of pop-up infrastructure. They saw that it was heavily used as soon as they came out of their initial lockdowns, heavily used by pedestrians and bicyclists across socio-demographics. And they said, we need better walking and cycling infrastructure because look how people use the stuff that we just throw out there with cones. And so they dedicated huge sums of money. And we've seen that in a lot of other places, not so much in the US, but a lot of other countries around the world and states around the world have done that. There are a couple of examples in the US where there are state level programs. Colorado and Massachusetts are good examples of state level programs to fund ongoing infrastructure interventions that have come online since the pandemic, since seeing these obvious examples of how if you put this infrastructure in, people will use it, even if it's temporary infrastructure, and they're capitalizing on that. But I would like to know how that new knowledge about the demand for walking and biking is affecting planning at the local level, how that's getting incorporated and integrated into local transportation policy, not just funding, but the actual on the ground implementation.
That's great, and you actually answered sort of my last question I was going to ask there about places that are learning this lesson well, or why what lessons have been learned from this. So unless you have any final comments on that, I think might leave it on that note. Anything else, Tab, to add?
Yeah, I guess just one thing, you know, I don't want to fall into the trap, and I don't want anyone who's here to fall into the trap of thinking about COVID as an opportunity to get this new infrastructure. I do think, you know, what it is, and we hear this language a lot, and I bristle because it was a tragedy, you know, and it's an ongoing tragedy around the world. But I do believe firmly that it is an opportunity to reflect on how we think about who gets to use space in public, who has access to the city, who has access to mobility infrastructure, who has access to opportunity. Because we saw a lot of the problems in our business as usual operations during COVID. I mean, if anything, it's not an opportunity to push an agenda, but it's more of a kick in the pants to change our practices. And hopefully, in the process of changing our practices, we can change outcomes. We can get to more sustainable and just mobility systems that aren't car dependent. And I guess that's sort of my final thought is we need to recognize that COVID showed us in unavoidable, inescapable ways that what we've been doing hasn't been working well. And hopefully COVID's also providing some examples of ways that we can do better and some mistakes that we should try and to make sure that we're not replicating with new practices.
Well, thank you so much, Tab, and thank you all to the audience for attending today's webinar. You can find slides and a recording of the webinar on our website, enotrans.org, after today's presentation. And the recording will also be emailed to all registrants within 1 day. And be sure to sign up for our mailing list to gain access to the free Eno Connector newsletter, webinar announcements, report releases, and more. Thanks again, Tab, for joining us, and to our audience for your participation. And make sure to sign up for our next webinar with Todd Littman, titled The New Mobilities, Smart Planning for Emerging Transportation Technologies. That's on our website. Thanks so much and have a great afternoon.
Thank you.